When most of us think of fluoride in the water and tooth decay, we think of kids. But the American Dental Association is raising the alarm that there's an equal risk of tooth decay on the other end of the age spectrum for people my age. Why is this the case? Because with age, erosion gradually exposes the root surfaces and bacteria work their way down into the cracks and imperfections of old fillings. Plus, older citizens make less saliva, a condition accentuated by many of the medications administered for chronic diseases. This means more acid contact for longer periods of time with the tooth surface. Finally, the natural tendency with age is to select softer and sweeter foods, which increase the risk for cavities. In the past, if you were lucky enough to survive beyond 65, you ran a very good chance of losing your teeth. As the ADA notes, elderly people in the past 50 years composed a relatively small proportion of the population. The majority of these people were edentulous and received dental care infrequently, and then only when they could no longer ignore their unmet needs. However, the rate of edentulism in the U.S. population has declined from just over 20% in 1972 to 13% in 2001. Today, more than 3/4 of Americans over 65 have their original teeth, and the vast majority are intent on keeping them. The ADA would like to help. They've launched a multifaceted 3-year program titled Oral Longevity to create educational resources and innovative programs for consumers and oral health professionals, targeting the specific oral needs of an aging population. Part of the program involves a re-emphasis on the basics, including regular brushing and fluoride and checkups. The connection between fluoride and healthy teeth was discovered way back in the 1930s. Fluoride helps prevent tooth decay, and preventing tooth decay is important on several different levels. Naturally occurring bacteria in the mouth, in the process of breaking down sugars and carbohydrates, produce acid. If the acid is present in large quantities and in direct contact with the tooth surface, it can eat away at the mineral surface of the tooth and create a crater or cavity. This makes the tooth more vulnerable to infection and destruction. Fluoride protects the tooth in 2 ways. First, it protects the surface of the tooth from acid breakdown, allowing less demineralization to occur. And second, where there is a breakdown and the beginnings of a cavity, it promotes remineralization and repair of the tooth. How are teeth exposed to fluoride? Well, 2 ways: in a topical form or in a systemic form. The topical fluorides include toothpaste, mouthwash, and professionally applied therapies. The systemic fluorides are ingested into the body and incorporated into the tooth formation process. This fluoride is obtained through water fluoridation or with dietary supplements like tablets, drops, or lozenges. Exposure to an appropriate mix of these types of fluoride leads to stronger and more attractive teeth. But we now know that keeping teeth healthy is not simply a cosmetic issue. Tooth decay is an infectious and transmissible bacterial disease that increases one's chances of heart disease and stroke. In addition to fluoride, for people like me, the ADA recommends the following. First, brush and floss your teeth at least twice a day with soft bristles. Second, replace that toothbrush every 3 to 4 months or even sooner if the bristles become frayed. Third, if you do wear dentures, remember to clean them on a daily basis. Take the dentures out of your mouth at least 4 hours every day. Fourth, consume optimally fluoridated water to prevent tooth decay no matter how old you are. If you choose bottled water, check the label for fluoride content. Fifth, quit smoking. Smoking increases problems with gum disease, tooth decay, and tooth loss. It also affects healing from dental procedures and the retention of dental implants. Sixth, visit your dentist regularly for complete dental checkups. For Health Commentary, I'm Mike McGee.